Okay, this video is about cancer screening, and cancer screening is an unusual topic. It's one of the most emotional topics, and I'll tell you this, I don't ever talk about this with patients, never, because I've learned in the past from experience, people go crazy when you talk about this subject. They get very pissed off. Most people are very ignorant and simple-minded, and they can't handle a sophisticated discussion. So my whole YouTube channel is really for smart people. This is not for generic public audiences, for average people, for people who consider themselves normal. It's for smart people who want to understand things and learn. So for those of you who feel that way, continue and I'll teach you what I know about this. I got 30 years of experience with this stuff. But I know from personal experience, this is a topic you cannot discuss with regular people because they get so pissed off. All right, so here it is. What is cancer screening? I would give the metaphor that, and I just made this up. To me, it's like imagine, a couple business partners climbed on top of a store at a shopping mall, and then they threw a giant net on top of the public, the people walking underneath. All of those people have just been turned into patients. So now you can make money off them. Okay? Now, I'm also going to read you a philosophic excerpt from Brothers Karamazov by Dostoevsky, the chapter on the Grand Inquisitor, because if you understand this philosophy, now there's also a lot of people who will tell me, oh, you don't need to talk philosophy, we just want science, we just want science. I got news for you. 90% of what people call science is just BS, it's just advertising, okay? And a lot of times philosophy and metaphor takes you where you need to get to understand things. So I think this is helpful. And again, this is for a small audience. This is only for people who really want to understand things. And see if you can get this metaphor. So in the Grand Inquisitor chapter, and it's written by Ivan, he's the most intellectual of the brothers, of the Karamazov brothers. And he's constructed this story where Jesus Christu has come back to Spain at the time of the Spanish Inquisition. And the Grand Inquisitor sees him there and has him imprisoned. And then he goes to speak with him. And this is the Grand Inquisitor speaking to him. And here is what he says. Why hast thou come to hinder us? For thou hast come to hinder us, and thou knowest that. But dost thou know what will be tomorrow? I know not who thou art, and care not to know whether it is thou or only a semblance of him. But tomorrow I shall condemn thee, and burn thee at the stake as the worst of heretics. And the very people who have today kissed thy feet, tomorrow, at the faintest sign from me, will rush to heap up the embers of thy fire. Knowest thou that? For 15 centuries we have wrestled with thy freedom, but now it is ended and over for good. Today men are more persuaded than ever that they have perfect freedom, and yet they have brought their freedom to us and laid it humbly at our feet. Dost thou know that the ages will pass, and humanity will proclaim by the lips of their sages that there is no sin, that there is only hunger? And we alone shall feed them in thy name, declaring falsely that it is in thy name. And in the end, they will lay their freedom at our feet and say to us, make us your slaves, but feed us. From the Grand Inquisitor by Fyodor Dostoevsky, 1821 to 1881, the Constance Garnett translation. It's the best of the translations. Okay. Now I'm going to show you the next metaphor that will help you to understand cancer and cancer screening. Imagine you are a farmer and you have, let's say, about 5 miles of enclosed farmland. This is supposed to be the fence that encloses the entire farmland. And in the center of the farmland you have another fenced-in area where you have some animals. And you've got some vultures and some turtles and some rabbits. Okay, now when people think of cancer, most people think of a rabbit. And the rabbit is the cancer you're trying to catch in screening. You see it making a run for the fence, you're going to trap it, do whatever you can, maybe stop it and save the patient's life, and it's beautiful, it makes everybody happy, win the lottery. Okay, that's a great story, and it does sometimes happen, all right? But I want to also let you know there are some cancers that are like a vulture, okay? And the vulture doesn't care about the fence. The vulture just goes up in the air, flies, kills the patient. All right, it does it very fast. It flies out of that, a couple miles. There's nothing to the vulture, and there's nothing anybody could do. Even if you screen, the cancer will show up and kill the patient before you do the next screening. So it can be like a bird, like a vulture. And by the way, this comes from George Kreil from the Cleveland Clinic, and also from Gilbert Welch. He's an epidemiologist who was at Dartmouth. And I tell you this because this is a model of how to understand cancer. And you need these metaphors to understand it. It's too complex a process to understand without these metaphors. All right, so just vultures are rapidly growing cancer that kills the patient. Okay, they're rare though. They're quite rare. When a young person gets one of these, they make a movie about it. Okay. All right. Now, here's the thing that hardly anyone knows. Most cancers are turtles. And when I say turtles, I mean they're so slow, they're never going to get out of your farmland. Ever. They're not going to get out of this little animal enclosure area. So the point is, sometimes no one can tell initially if the cancer is a turtle or a rabbit. And it happens very, very, very commonly that turtles are mistaken for rabbits. And probably one of the most common scenarios where this happens is in the prostate. The average guy, he means well. He says, I'll go get my prostate checked, get my PSA checked. Next thing he knows, he's got elevated PSA. He's in the urologist's office. Boom, 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 boom. He's getting a prostate sextant biopsy, 12 core specimens, big honking needle ripping through his prostate where there's nerves of erectile function running right through there as well. And then he's told, oh, you got a cancer. And the guy's like, oh my God, I got cancer. Oh my God, I'm going to fight this thing. I got a cancer. And the surgeon says, I'll put you on the schedule for next week, prostatectomy. Okay, guy gets a prostatectomy. And unfortunately, significant number of times, not always, but a significant number of times it's complicated by impotence, very common. Incontinence, not that uncommon. Sometimes there's chronic discomfort in that area. Okay, and what's the point? Well, if he had a turtle, it never would have caused him any problem anyways. He would have died of something else. He would have never known he had it. Did he do something intelligent by getting that screening and now making himself impotent, incontinent, and in pain? He's wearing a diaper, okay? And he just lost a lot of money paying for all those health bills and missing all that time from work. And it's harder for him to do what he used to do. Was that intelligent to do that? Okay, and so why is it such a big deal to talk about screening? Because patients love it. I know patients, they don't know anything about cancer. They don't know anything about health. They don't take care of themselves. Oh, and you might be asking, why did I go through the Brothers Karamazov excerpt there? The reason is, in my experience, 99% of people, they don't want to take care of themselves. They don't want to change their diet, be healthy and exercise, quit smoking, drinking alcohol. They want the doctor to save them, okay? So, okay, you want the doctor to save you, fine, good luck, all right? The purpose of this website is, sometimes where a doctor will save you, sure, okay? But the reason I'm trying to teach is that for a lot of cancer, you're best off learning how to save yourself. And that was kind of the metaphor there, that almost no one wants to save themselves. There's a small audience of highly intelligent people that want to watch YouTube videos like this, so I provide them to make them available. But I realize this is a very, very, very small audience, okay? And so I'm going to show you this stuff, but you won't hear this elsewhere. Doctors with experience know what I'm telling you, but it's not well known, and again, I would never discuss this with a patient because I know they'll freak out and get pissed off. I don't even discuss this except with some real smart doctor friends because, everybody loves screening. The patients love screening. And people say, oh, well, what do you mean they love it? The reason I know people love it is people line up around the block all over the world for screening. They love it, okay? They'll do it. If you tell somebody to go low-fat vegan, I got lots of doctor friends who I recommend to go low-fat vegan, and though some of them will do it gradually, but very, very few, okay? So the thing that will help them the most, they don't want it. But the thing that, may or may not help them and is pretty high risk to cause major complications, oh, they love it. Because they think they can turf the responsibility of their health to someone else. I'll get this quick test, and then I'll get my cancer fixed, and I'll be fine and my life go on. And a lot of, poor dummies have done that, and now they're incontinent and impotent and in pain. Okay, so like I said, there's tons of money in this. All these people who were previously walking around just living their lives are now cancer patients or potential cancer patients. Okay, it generates tons of patients. So everybody in the medical business loves it. It's easy money. And I think cancer screening is going to continue. I think it's going to continue to grow. It's going to get bigger and bigger because everybody loves it. Hospitals love it. Patients love it. So fine. Okay. But I've got 30 years of experience with it, and I know a lot about it. And I can tell you I'm not too enthusiastic about it. Now, think about it. Let's say you're a private practice hospital and you want to make money. Okay. You offer the patients a free screening of whatever it might be. All right. And you give it to them the first time free. And why do you give it first time free? Because what patients don't understand, patients think they're just going for a check, like a cholesterol check, blood pressure check. No. When you get a cancer check for a lot of different types of tests, they'll very often require a follow-up. Like let's say you go in for a CAT scan of the chest for lung cancer screening. Well, guess what? You're going to have some little scars in your lung from something that happened when you were a kid. Okay, but we can't tell with one photograph in time. You got to come back for follow-ups at least 2 years, maybe 5 years. 2 years for a solid micronodule, 5 years perhaps for a ground glass nodule. And guess what? We're going to catch the upper abdomen on that CAT scan. We're going to catch your liver. Well, there's a low-density lesion. What is it? It's probably a cyst, but we don't know for sure. Go for an MRI. What's in the kidney? It's probably a benign cyst, but we don't know for sure. Go for a CAT scan with IV contrast, perhaps an ultrasound. Oh my goodness, there's a thinly septated cyst. That's a mildly complex cyst. It's probably a Bosniak 2, but it could be a 2F, maybe a 3. We better follow it up. 5 years of follow-up right there. Okay. So what I'm trying to say is for every rabbit that's caught and saved, there are a lot of these turtles, and not even turtles, whatever you want to call them, nothings that are just benign things that are follow up because no one can tell at first what they are. And so, getting back to, let's say you're a private practice hospital and you want to make money. Well, you bring them in for free the first time, and then they have to pay for the follow-ups. And then, they're going to get billed for that. Maybe they got a copay with their insurance. That could be a lot of money. The patients are scared they have cancer. There is nothing that scares a patient like the C word, okay? And you just tell them they could have cancer, and you can get them to do anything, all right? Except the only thing you can't get these people to do is open a book and read about their situation. And that's what I'm saying. The fact that most people are functionally illiterate and so trusting of any authority figure, they're easy to make money off. You just tell them, look, you could have cancer. You must do this. Okay, I'll mortgage my house. I might have cancer. I have to do this. Okay, and it can screw up their life too. They're waiting. Should they get married? Should they buy a house? Should they do something important? Well, I can't make a decision until I know whether or not I've got cancer. Well, good. You know what? It could take 2 to 5 years of follow-up to figure that out. So, like I said, the patient thinks they're doing something good, being proactive, going for screening. I'm improving my health. I'll catch this cancer early and then I'll be saved and I'll be fine and everything will be great. Patients don't know anything about the issues with false positives. False positives are much, much, much more common than true positives of actually finding a cancer, yet alone finding a rabbit, okay? Out of all those true positives for cancer, most of them are not rabbits. Most of those are turtles, okay? And sometimes you think you're dealing with a rabbit and you're dealing with a vulture, okay? And then they don't know anything about the treatment side effects, which can be a big deal, okay? Now, they don't know anything about lead length bias. Lead length bias means that if, let's say you have a vulture as a cancer, right? And you diagnose it in the year 2000, and then the patient dies in 2005. Somebody will say, well, usually vultures are dead within 2 years, so the patient lived that longer. No, not necessarily. You just diagnosed it earlier. It didn't change their outcome necessarily, okay? That's getting a little more philosophical. We're not going to go into all this epidemiologic data. I'm not going to go into statistical data. You can look that up on your own if you want. I'm simply providing for high IQ people the concepts that they need to read and study this topic intelligently, okay? And then there's a question is, for some diseases, there is no treatment that works. There's always going to be some standard of care treatment that is tried. In the United States, for example, there's a reward for always doing more. It's the psychology of the American people. It's the psychology of the American medical system. We must try. Give it the old college try. You got to go for it. I'm going to fight this cancer. But what they don't tell you, and what a thinking person says, sometimes you don't want to do something. You want to just stand there. And the point being that it's not always better to do something. If you have a type of cancer for which there is no good treatment, nothing is shown to work, you might be better off doing nothing, okay? And I know people freak out when you say that, and I can tell you I've done tons of procedures where I'm told things like, we have to do something, the family wants something done, we must do this procedure. And really the question for me would be, will this help the patient? And I can tell you, there is so much psychological pressure coming from patients' family. The families want it. They want something done. Even if you tell them it's probably not going to work and it might cause complications, they're like, well, we want something done. We have to try. And they're like, you don't understand cancer. It's not always best to do something. Sometimes the person who has the best survival is the one who does the least. You have to look at every situation individually. Okay, and so the next question is, what's going to happen to the health insurance when they're labeled as a potential cancer patient? And what this is like is it's reminiscent of calcium, supplements for osteoporosis. You hear, oh, you got osteoporosis? You don't want to get osteoporosis? Take a calcium supplement. Oh, isn't that clever? Isn't that wonderful? You fixed the problem. And then everybody's happy. But you look at it a little closer, you're like, gee, the death rate in the calcium supplement patients is much higher than in the ones we didn't do anything. Huh, look at all these Bantu women. They don't get any calcium, hardly any compared to American women. They have no osteoporosis. Maybe calcium's not the real issue. And that's what I'm kind to say. When you look at screening closely, you start having those types of observations. What about all those low-grade cancers, all those turtles that would have never caused any problems? And now the patients are labeled as cancer. Nobody knows for sure what's going on, so they get treated with surgery and chemotherapy. So now, for a turtle that would have never caused any problems whatsoever, you would have never known you had it when you die happily at 90. Instead, now you're 60 years old, you've got a turtle, but no one knows for sure it's a turtle, so you're going to get surgery that's going to be painful, and then you're going to get chemotherapy, which could have significant side effects, because no one knows, and it might be a rabbit. So what about all those men with low-grade prostate cancer? And, they get prostatectomies, and a significant number end up impotent and incontinent. Was the surgery really needed? Are they just ignoramuses who volunteered to make themselves impotent and incontinent and possibly bankrupt? Is that intelligent to do that? Have they read anything? In my experience as a doctor for 30 years, patients almost never read anything. Patients almost never know anything significant, useful, or meaningful about their disease. Have they read the Dean Ornish paper on vegetarian diet and low-grade prostate cancer, where they maintained and lowered their PSAs? Have they heard Dr. McDougall's lecture on prostate cancer? Have they heard Gochke on breast or thyroid cancer? Have they read George Crowell, Gilbert Welch? Those two developed that bird, rabbit, turtle analogy metaphor on cancer screening. No, the patients just risk their life because it sounded like a good idea, like calcium for osteoporosis, and it's really behaving kind of impulsive, ignorant, like a teenager. Okay, so for what it's worth, those are the theoretical issues. I've got a lot of experience in screening, and in my experience, it does sometimes save a patient. That's like winning the lottery. But in my experience, more often than not, you got a lot of turtles. I'll leave it at that.